Okay, let's dive right into this. Welcome to today's Explainer. We're unpacking a really fascinating policy announcement directly from India's health ministry. It's a brand new initiative designed to fortify public health, and we're talking on a truly massive scale here. We're going to see exactly how a nation strategically arms itself against an enemy it can't even see. We'll look at the specific tools they're deploying to modernize disease tracking in one of the world's most heavily populated and geographically diverse places, literally transforming how they prepare for the next big biological event.
So ask yourself, how do you actually guard against an invisible threat? It's a crazy logistical puzzle. I mean, we aren't talking about your traditional military defense here. No borders, no checkpoints, no standing armies. We're talking about biological defense. When your adversary doesn't wear a uniform, completely ignores political borders, and is quite literally microscopic, well, physical walls are completely useless. You need a radically different kind of strategy. The infrastructure has to be incredibly fluid, highly responsive, and embedded right into the communities it's trying to protect. It's all about weaving a net that can catch a microscopic anomaly way before it spirals into a macro-level disaster.
To really understand the shield they're building, we first have to zero in on the specific threat at the heart of this policy, the zoonotic jump. As we've seen in recent global health crises, when an infectious disease makes that leap from an animal to a human, the disruption is absolutely catastrophic. And India's ecosystem is uniquely complex. You have these incredibly dense urban centers, completely overlapping with massive agricultural belts and wildlife habitats. That makes it a major hotspot for cross-species transmission. You know, diseases like Nipah or avian influenza, they don't just appear out of nowhere. They start at this exact biological intersection, making it the absolute focal point for modern public health defense.
And that brings us to the core logistical nightmare for public health officials, tracking the jump. Because these pathogens originate in wildlife or livestock, they're brewing in populations that, well, they simply don't check in to the local emergency room or rural clinic when they start feeling under the weather. Tracking a virus out in the wild before it becomes a widespread human crisis is notoriously difficult. Honestly, by the time a patient zero shows up with symptoms, the invisible threat has usually already breached the perimeter. The pathogen has had days, maybe even weeks, to circulate, mutate, and adapt to its human hosts, totally undetected.
Now, what's really interesting about this is, since we can't exactly build a brick wall to keep out a microscopic pathogen, our absolute best defense is data. We need to know exactly where the threat is, if it's mutating, and the precise moment it tries to cross over into humans. So surveillance isn't just passive observation, it is the active, vital, early warning radar for our biological defense. A really solid surveillance network is out there constantly sampling the environment, looking for tiny patterns and anomalies that whisper something is wrong long before a full-blown outbreak makes the headlines. It's the crucial difference between preemptive containment and scrambling for reactive damage control.
Conceptually, you can think of this biological radar operating in three distinct phases. First is the biological spark, the actual animal-to-human transmission. This is the exact moment the barrier breaks. Step 2 is detection. For this, you need a system sensitive enough to pick up weird health events in super remote areas and pick them up instantly. And finally, Step 3, the response. Once a threat pops up on the radar, how fast can authorities move to box it in? The harsh reality of epidemiology is that these three steps are locked together by time. If your detection is slow, your response is pretty much useless, and that transmission phase just explodes.
In epidemiology, we rely heavily on sentinels to bridge that gap between transmission and detection. But here's the thing. In the context of this new policy, we aren't talking about soldiers holding rifles at a border. We're talking about frontline health workers, local veterinarians, ASHA workers, and rural clinic staff spread deep across India's diverse map. They are the individuals standing right on the absolute front lines, keeping watch. They're the ones who actually notice when an unusual number of livestock gets sick in a village, or when a sudden cluster of severe respiratory cases pops up in a crowded neighborhood. Their eyes and ears are the true sensors of this entire network.
So the crucial point is India's recent, massive upgrade to this frontline system. The government has officially rolled out an initiative to create a network of digital sentinels specifically designed to strengthen their zoonotic disease response. This means we're moving fast from the abstract theory of biological surveillance into a highly specific, real-world deployment. This is no longer just a conceptual framework. It's a tangible rollout of tools designed to completely modernize how these human sensors collect, process, and beam critical health data back to central authorities.
To really appreciate the magnitude of this shift, you have to contrast it with the old way of doing things. Standard surveillance often choked on friction. We're talking slow, paper-based reporting, fragmented phone calls between remote outposts and central labs, and critical days literally lost just to manual data entry. And let me tell you, when you're fighting a virus that replicates exponentially, friction is fatal. The digital Sentinel approach is a total paradigm shift. It's all about networking these human guards digitally so that vital data, urgent alerts, and shifting epidemiological trends can move at the speed of the internet, actively outpacing the pathogen itself.
But how do you actually do that? How do you standardize and upgrade a network of human sentinels across a country as unimaginably vast as India? Well, the Health Ministry's solution is surprisingly elegant: e-learning modules. I know, it sounds simple, but it is fundamentally transformative for public health infrastructure. Instead of mailing out static paper memos that just get lost in a drawer or trying to pull off impossible logistical feats of in-person training, they are beaming interactive, standardized, and immediately updatable training straight to the mobile devices and computers of the workers on the ground.
And this brilliantly illustrates exactly what the policy is doing. This isn't some small, localized pilot program. It's a comprehensive strategy executed straight from the top by the Health Ministry. By rolling out this dense, digital learning resource package, they are systematically standardizing the knowledge base of their entire frontline workforce. Every single veterinarian and clinic worker is getting the exact same high-level playbook. The core goal uniting all this new digital plumbing is singular: to actively arm their sentinels with uniform, cutting-edge knowledge. If everyone knows exactly what to look for and how to report it instantly, you drastically shrink response times across the entire board.
Think of this strategy as scaling the watchtower. Bypassing the absolute nightmare of organizing in-person training across India's massive, diverse landscape is a total game-changer. From the freezing heights of the Himalayas down to the dense tropical south, they can now train thousands of health workers simultaneously in real time. And by doing that, they're vastly expanding their active network. They're effectively building a much taller watchtower and casting a significantly wider biological radar. This ensures that the old blind spots, deep in rural or forested areas, are now systematically illuminated and watched.
Now you might be sitting there wondering, why does a domestic health policy in India matter to me or the rest of the world? Well, the unvarnished truth is that global health security starts locally. India is a massive population center, and it has these deep, complex intersections where expanding cities smash right up against rural farming communities and diverse wildlife. Strengthening surveillance there doesn't just protect the local population, it acts as a critical buffer for the entire globe. In our deeply interconnected world, think international flights, global trade, a robust digital sentinel network in one key region acts as a vital biological shield for the rest of us.
Which leads us to a crucial, pretty provocative thought to wrap up this explainer. As these newly launched e-learning modules deploy across the country, actively training and connecting the next generation of digital sentinels standing watch on this frontier, are we, as a global community, finally ready for the next zoonotic jump? India is actively upgrading its shields and providing a really fascinating, scalable blueprint for pandemic preparedness in the process. But it forces us to ask, is the rest of the world doing the same? Thank you so much for joining me to unpack this. Keep learning, stay curious, and I'll see you in the next explainer.